You know, it's very honeycombed on her skin. It's a very good response.
All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We're here in Manhattan doing our second part of our acne scar treatment protocol. See, I marked out these areas because after halo, there's swelling and there's sort of very difficult to see on the surface because look at all these sort of dots on here. This is from halo. This is where she's gonna peel. So now I'm gonna do CO2 right on top. So we're gonna start that again. Here we go.
Do you treat black skin? Yes, we do, guys.
Okay, and we're doing now the ultra pulse to the area she has deeper scars. And we have a whole plan for her as to what we're gonna do. That's the key, is making sure you just go through a full treatment protocol. Okay, and I'm going stronger in the areas where I have my markings because I know that's where the majority of the deeper scars are because I marked them. And I could see that the surface needed a little bit more. The good thing is that we did the 1470 underneath this so that it's going to improve long-term collagen production and not just that initial peeling phase like we see with the erbium. So this is the CO2. So this is much stronger. It's a lot hotter.
Do you plan to visit Toronto?
That is a very good question. We are working on licensing right now.
They're asking about chemical peels for this.
We would do like preparation or after.
As we can do pre and post, depending on what you guys want to do.
So normally we would do a peel before and after. With her skin type, it was really up to her. You don't have to do it before. Just skincare before is important. The after would be good. She may not even need that either because her skin's so light. But again, if people get a little bit of that dusky discoloration after laser, doing a peel is not a bad idea. Someone like her, she could actually do an enlightened peel or just do my Aerify kit every couple weeks, starting from right when she peels. Almost done on the side.
Your skin is getting burned. Yes, it is.
We're doing the CO2, you guys. This is a control burn. You guys see I feathered certain areas, because some areas need it more than other. Okay, perfect. Let me see you straight for a sec. Stay right there. So just being meticulous, getting every area. Okay, so now we're gonna go to the opposite side.
People are asking you, what about your diet?
That is a good question. The diet went a little awry here in New York, but don't worry, I'm back on it tomorrow. So I'm gonna be back full force. I will show you my workouts.
So looks like you're cooking bacon. Does it smell like it also?
No, she smells wonderful actually. Whatever perfume she wore today, it's great. No, this does not smell bad. We have a suction device there.
Do you do it to the neck as well?
You can do it for anti-aging. It's not necessary for her. Personally, I do that in a lot older of a client. I would go more a non-ablative or just do our halo down there for now with BBL. So again, working a little more concentrated over this area that I marked. She's almost done. Quite phenomenal today.
So scary. I would love to see the end result.
We will send it, I promise.
Guys,
And then again,
we'll
these
show you
other...
the healing process as well.
Turn all the way to the right
do I need
now.
to get rid of sunspots,
Like
guys?
that.
We have several lasers and treatments for sun damage. Send us a DM, full name, email, phone number.
Many different things we could do. We could do peels at home from emeragecosmetics.com. You guys could come to the office and do BBL and other lasers. There's peels we can do like Rev peels, skincare protocol. For her, I think her healing is going to be a lot more quick with Hyla B, AOXY, anti-age serum, and using our refit. A BioShield is a good product that we use afterwards at night on top. to help it heal much more
I want
quickly.
to know about her pain levels.
How are you feeling now with the CO2?
I definitely feel this.
Yeah, like a 5 or out of 10?
Like a 5.
That's usually what it is. But it's quick, it's done. All right, I'm just checking and making sure everything is good. Tend to do kind of a feathering pass on top here from the side.
As long as it gets those stars, I'm happy.
Exactly. I'm gonna do a little bit on your chin because I just want to kind of blend. You have some chin scarring, so I'm gonna go, even though we were gonna do just cheeks, I'm gonna blend it.
How many sessions of CO2 to get rid of crow's feet wrinkles?
I always tell people those, if they're deep, usually like 2 in a 6-month time period. You can also do contour and get do basically one treatment.
A lot of people interested in this treatment, guys. Send us the
Again,
DM,
as you guys can see, this is called the side pulsing. So this helps, especially those like boxcar ice picks. You just do kind of a little side pulsing, and that gets the walls of the scars a lot more readily when they're that angled type of scar. Okay, perfect. So she finished. So this one was more painful for her, but it was worth it. She wanted it done, and you guys can see the difference. I'm gonna show you. Here's ablative. I'm gonna take this off really quick. Keep your eyes closed. Here's the ablative area, which is charred, and here's the non-ablative area, which is just kind of punched out and doesn't look as charred, because this is more heat, this is less heat. So now we're gonna apply our hyaluronic serum. This is Hyla B from emeragecosmetics.com, and then Rosa, our nurse to be in training very soon over here, is using PRP right now. Post care, yep, we're gonna microneedle lightly all this in. Now, why are we gonna do that? Because when you ablate the skin, and again, Hyla B AOC can be applied immediately afterwards. I taught this to my Beautify You group. Kelly, wonderful nurse from Michigan, and now they're following my protocols using the Aerify kit immediately after as well. Okay, grab me that microneedle. You can apply this immediately. And then what you need to do is you just do a small amount. You don't need to do really deep. You don't need to go too deep with the microneedling, because we've already created, I just want to create some light channels. So pinpoint bleeding, you guys will see that come up. Remember, we just ablated. We don't need a ton of blood. And we're just pressing the PRP, the Hyla B, the AOC into the skin. So you can see the light pinpoint bleeding. Exactly how we want it. Okay. And then she's going to continue to apply the PRP, which is the growth factors from her own blood to help her heal. Can I grab the mask? People go around here.
Alright, let's see the questions. I read some of those off.
And then last
What is
part.
the mark of your microneedling?
Last part, I'm going to grab you guys our Emer Skin Intense Hydration Mask. I'm going to add one on right now for her. This has in it more Hyla B, AOC, our growth factors from our refit line, peppermint extract for cooling, so we're going to wipe that on. And there's a lot of juice in there. I made this on purpose with a lot of extra juice. Okay, we'll get her eye in a second. Again, the Emer Skin, you can get this at emeragecosmetics.com. All your providers, best mask you'll ever use after a laser treatment, microneedling, derma rolling, facial. There is also tea tree extract in here to help for anti-inflammatory and anti-acne. And it just smells really good because there's some botanical extracts too for calming. So I'm gonna put that on her now. Get her cooling. We want her to cool down immediately. and then she's done. So that one hurt more, but she did great. Didn't really have much pain overall. It's really good. So again, this mask, there's a lot of serum in here we're gonna give her to take home to use. You get this at MirageCosmetics.com, or if your provider, let me know. Cold air to help her cool. And she's gonna use these masks over the next few days to help her heal. And that's it, guys. It's part 2 of CO2 for CO2 microneedling PRP for acne scars. All right, make sure she gets this home too, okay?